Hello, I'm John Bell and I'm here with Sabiha Essack. We're at the FIP Congress in Glasgow, the International Pharmaceutical Federation Annual Congress, which is the biggest international pharmacy congress in the world, annual congress, along with about 3,000 or so other pharmacists. One of the things we've been discussing, actually been to a session or two on antimicrobial resistance. Now I know, Sabiha, you're not just an expert from South Africa, you're an international expert in this area of antibiotic resistance and antibiotic stewardship. But can you tell us your leading role, in particular in relation maybe to WHO and some of the organisational groups that you work with?
Thank you, John. Thank you for the kind words. Antimicrobial resistance has maintained unprecedented momentum on the global public health agenda, with a number of global political declarations, resolutions, and policy statements. As you know, I am part of the FIP working group on antimicrobial resistance, and I played a role in developing the FIP policy statement, which was adopted by the Council in Seoul in November last year, which was 2017. I also serve as an expert consultant to the World Health Organization on the implementation of 2 of its 5 strategic objectives of the Global Action Plan on Antimicrobial Resistance. These are the Strategic Objective 1 on education and awareness, and Strategic Objective 5, which speaks to optimizing antibiotic use by means of stewardship. Now, you know, as a member of GRIP, that GRIP has developed several excellent resources on education, awareness, and stewardship that can be used to champion change.
Yes, indeed. Well, you mentioned GRIP, the Global Respiratory Infection Partnership, of which we're both members. And one of the areas that GRIP works with, as the name might imply, is upper respiratory tract infection. And we know for a fact, of course, that that's an area where there's so much misuse, inappropriate use of antibiotics. I guess we've all been, all of us pharmacists have seen people go to the doctor for a sore throat, they come back with a prescription. Often we believe, and in our good judgment, are pretty certain that an antibiotic is not necessary. Now, why is it that doctors are still prescribing these antibiotics without, I think, really good cause?
I think that patients believe that the antibiotics will make them better faster, and so they insist on a prescription of antibiotics, and we know that that's simply not the case. Antibiotics do not relieve pain, nor do they have any anti-inflammatory action. And if we can make patients understand this, they will feel less inclined to visit the doctor and not insist on antibiotics even if they do visit the doctor.
Yeah, sure. Well, I think we nonetheless do have a very strong educative role to play with our patients in a couple of ways, I think. Firstly, we can recommend non-prescription, I believe, perhaps symptomatic treatment for sore throat before the patient goes to the doctor. And also, of course, when the patient sometimes comes back with a prescription, we can counsel on the most appropriate use of that antibiotic. But also, of course, even at that stage, give the patient some extra information and product, perhaps, an appropriate product to relieve the immediate symptoms, the symptomatic treatment.
I absolutely agree with you, John. But we know that there's much more we can do as pharmacists. In some markets, as you know, antibiotics are available or can be accessed in pharmacies without a prescription.
Yes.
And that should be unequivocally discouraged. The inappropriate distribution of antibiotics is increasing the global antibiotic resistance burden.
Sure.
And we as pharmacists have a leadership role to ensure appropriate and rational antibiotic use.
Yes, indeed. And unfortunately, there are some markets, some countries where the regulatory framework is really not strong enough to overcome that problem and prevent the inappropriate, I suppose, recommendation of antibiotics without prescription even. There's another area too, I think that we can address. There are some non-prescription products which contain antibiotics, and really I hope you'll agree, I'm sure you will, that this is an area we really need to discourage, that we should never be recommending, nor do I think they should be available for recommendation.
I completely agree with you, John. Any kind of antimicrobial use has the potential to contribute to antibiotic resistance. I'm sure you're aware that the World Health Organization and various other bodies around the world host World Antibiotic Awareness Week every year. This is a forum for highlighting the risks of uncontrolled antibiotic use. We as pharmacy and pharmacists have a leadership role to play both in the hospital and in community settings. Antibiotic Awareness Week is held in November every year, and we all can get involved. I'm sure you believe this as passionately as I do.
I do, Sabiha, very much so. I think the challenge for us as pharmacists, and pharmacists both working individually and for our professional organisations, is to work proactively to beat that problem of antibiotic resistance. It's a global health crisis, and we should be taking the lead. We can do that. We can do that. Well, if we need support, we're here to help, along with the Global Respiratory Infection Partnership, so well supported by Reckitt Benckiser. We have the materials that will help you do the job so much better in the community, talking to our patients, talking to doctors, in fact, educating ourselves to do that job so much better.